Loomis, and I'm going to be talking about using critical thinking during an interview. The goal of this is to be able to use verbal and nonverbal skills and critical thinking skills to optimizing the process of getting the correct information for the patient's chart. The materials that are used for this are the progress note, patient chart, or the EHR, the electronic health record. So we're going to be talking about example 1, which is getting an underlying meaning. So the patient that comes in is a female patient with type 2 diabetes, and she has recently started starting insulin injections, and she's here for a follow-up visit. So in an interview process, it's good to use open-ended questions. So in this case, with this patient, I would ask her, so how are you managing your diabetes? And this will allow her to explain exactly what's going on in her own words. And the patient says that she can't get used to the whole idea of having to do the injections. So to encourage her to explain further what she means, I can reiterate what she just said and say, oh, you seem to be having trouble with your injections. And this response should encourage her to give me a more specific area and why she's having trouble with the injections. If it's the syringe, injecting herself, or if she doesn't have enough time for the injections, or what exactly is going on with why she's having trouble with the injections. And then verbalizing her response to her. Say, for example, if she's having trouble injecting herself. So I would say, okay, so I see you're having trouble injecting yourself. And that lets the patient know that I'm hearing what she's saying and reiterating, and basically a verbal cue, and letting the patient know that I'm hearing what she's saying. And then after I get the specific problem of what exactly is going on, she said she's having trouble injecting herself, so I write that down on the patient's chart for the doctor. So the doctor knows exactly what's going on. And that's using critical thinking during an interview.